What organs does CF impact systemically? Imagine a condition that touches almost every part of the body, not just the lungs. That's what cystic fibrosis does. It's a genetic disorder caused by mutations in the CFTR gene, which leads to faulty chloride ion transport across cell membranes. This defect causes thick, sticky mucus to build up in many organs, affecting multiple systems throughout the body. The lungs are the most well-known target. Thick mucus clogs the airways, trapping bacteria and causing repeated infections. Over time, this leads to inflammation and progressive lung damage, making breathing harder and reducing lung function. This is why respiratory issues are the main concern in cystic fibrosis. The sinuses are also involved, with mucus buildup causing chronic sinusitis and nasal polyps, which can further complicate breathing. The pancreas is another critical organ affected. Normally, it releases digestive enzymes to help break down food. But mucus blocks the pancreatic ducts, preventing these enzymes from reaching the intestines. As a result, people with cystic fibrosis often struggle with malabsorption of fats, proteins, and fat-soluble vitamins like D, E, and K. This can lead to poor growth, weight loss, and nutritional deficiencies. Additionally, damage to the insulin-producing cells in the pancreas can cause cystic fibrosis-related diabetes, which requires careful management. The gastrointestinal tract also feels the impact. In infants, thick meconium can cause a blockage called meconium ileus. As people age, they may develop other issues like constipation or distal intestinal obstruction syndrome, which is a blockage in the lower small intestine. The liver can also be affected when mucus blocks the bile ducts, leading to liver problems such as fatty liver, cirrhosis, or gallstones. The liver and gallbladder are affected by the same mucus buildup in the bile ducts, causing inflammation and sometimes jaundice or scarring of the liver tissue. Gallstones can also form from the thickened bile. In males, cystic fibrosis often causes congenital bilateral absence of the vas deferens, which results in infertility. Females may experience reduced fertility because of thick cervical mucus, but many can still conceive with medical assistance if needed. Other parts of the body are impacted too. Sweat glands produce sweat with abnormally high salt content, which can lead to salt loss and dehydration, especially in hot weather or during exercise. Bones may become weaker over time due to malnutrition and vitamin deficiencies, increasing the risk of osteoporosis. In summary, cystic fibrosis is a systemic disease that affects many organs beyond the lungs. It impacts the pancreas, gastrointestinal system, liver, reproductive organs, and even the skin's sweat glands. The widespread effects come from the malfunctioning CFTR protein, which causes mucus to become thick and sticky everywhere it goes. Managing cystic fibrosis requires a team of healthcare providers working together to address these various organ issues, helping improve quality of life and extend lifespan. Always remember to consult healthcare professionals for personalized advice and treatment options.